The skin falling off after CO2 laser is a very common experience that a lot of patients have. But when is it going to start happening? And what does that mean for you and your healing process? In today's video, we're going to talk all about the timeline of CO2 laser skin falling off and what you can expect throughout the entire healing process. Hi everyone, I'm a board-certified facial plastic surgeon. I specialize in facial rejuvenation, and today we're talking all about carbon dioxide laser resurfacing. So if you had a carbon dioxide laser treatment and you're wondering when the skin falling off starts or what it means, then definitely stay tuned. So the laser treatment works by basically vaporizing or ablating the top layer of skin. And as that happens, it leaves a wound bed underneath that needs to heal. That healing process takes multiple steps. And each of those steps has a sort of a timeline associated with it. So let's go through the timeline. In general, we break this down into 4 different phases. So the first phase is immediate post-treatment. This is the first 5 to 7 days after you have your carbon dioxide laser treatment. So right away, you can expect there to be redness, swelling, burning sensations. It's very common to have the skin feel really tight and irritated. And you may see some dark brown or black skin kind of discoloration in areas like under the eyes, around incisions. These are just normal, expected findings. The reason why you have this darkening is because the skin has been burned in a controlled fashion by the laser. Now that skin is going to try to heal itself and protect itself. So it's going to make itself darker to protect itself from sun exposure. And also, this darkening is just related to the healing process. So please don't get too concerned about it. The second phase of healing is what we call the healing phase. This occurs typically about a week or 2 after treatment. At this point, you may still see some dark brown or red skin, but it usually subsides a little bit. You may still see some peeling or scabbing. So the scabbing occurs because the body is trying to heal and repair itself. And as that happens, you can see some scabbing over the wounds. Again, that's completely normal. You should unpick at the scab or pull at the scab, because that can disrupt the healing process and it can potentially lead to scarring. So just let the healing process happen on its own. Don't pick at it, don't pull at it, let it heal on its own. And that goes for the peeling as well. You may see the outer layers of skin that were affected by the laser start to peel off and slough off. Again, that's completely normal. Shouldn't pick at that either. Let the skin heal and regenerate on its own. At this point, about a week or 2 after your treatment, you'll probably see a lot of the scabbing or peeling start to subside. And then we enter the third phase, which is the burn skin shedding. And this is when you're going to see the real change in your skin. This can happen anywhere from 2 weeks to maybe even 3 or 4 weeks after your treatment. And what happens is that the top layers of skin are burnt off by the laser, and now the bottom layers of skin start to come to the surface. This is where you'll see the real change in your skin, especially if you had deeper dermal layers of skin involved with the laser treatment. And then finally, the last phase of healing is what we call full recovery. And this can take anywhere from 3 to even 6 months after your treatment. During this time, your skin continues to heal. The collagen continues to remodel. You're going to continue to see changes in your skin over this period of time. You'll probably notice that the redness, the irritation, the inflammation starts to go away and the skin starts to become smoother and tighter. Now, this can take a while, and again, it depends on the depth of the laser treatment. If it was a deeper treatment, then it's going to take longer for the skin to recover, because the deeper skin layers are involved in the healing process. So let me walk you through specifically what you can expect based on the areas that were treated. So first, if you had laser treatment under the eyes, the under-eye skin is very delicate. It's very thin. It's prone to scarring. It's also an area that has a lot of oil glands, which can make the healing process a little bit more complicated. Typically, the under-eye area is going to take a little bit longer to heal. And you can expect some lingering redness or brown pigmentation for a few weeks after the initial healing process has occurred. And that can be anywhere from 7 to maybe even 6 weeks before that area looks fully refreshed and healed. If you had incisions on your face, whether they were incisions for a facelift or eyelid surgery or whatever the case may be. Then you can expect these incisions to take a little bit longer to heal. Generally, an incision site is the most vulnerable area, so it needs a little bit more time to make sure it heals properly without infection and without excessive scarring. So it's important that you follow your surgeon's guidelines for incision care. Keep the area clean, keep the area dry, and don't pick at the incision sites. That can lead to scarring and infection. Similarly, if you had laser treatment around the ears, then you can expect these areas to take a little bit longer to heal as well. And again, follow your surgeon's instructions to ensure proper healing of these areas. Now that we talked about the timeline and what you can expect, let's talk about what you can do to help speed up the healing process. First and foremost, you need to make sure that you're avoiding sun exposure. Sun exposure is the worst thing you can do for healing skin. The laser treatment makes the skin very sensitive to sun exposure. And if you have sun exposure at this point, it can lead to significant complications, including increased pigmentation, burning of the skin, and it can set back your healing process by weeks. So it's important to make sure that you protect your skin from the sun. This means using sunscreen, wearing a wide-brimmed hat. Make sure that you cover your skin to protect it from the sun. The second thing you want to do is make sure you're moisturizing and hydrating the skin. So your surgeon will likely prescribe you a moisturizer or a healing cream to apply to the skin. Make sure you use that as directed. That can help to keep the skin hydrated and promote the healing process. What are some things you shouldn't do? First and foremost, you should never pick or scrub the skin. Picking at the skin or scrubbing at the skin can lead to scarring and infection. So it's important to let the skin heal and regenerate on its own. Don't touch your face. Touching your face can introduce bacteria onto the skin, which can lead to infection. So avoid touching your face as much as possible. Also, don't pick at the scab. Don't pick at the skin. Just let the skin heal on its own. Now, when can you see results? Well, the results are going to depend on a number of factors, including how deep the laser treatment was, what areas were treated, and how well you take care of your skin during the healing process. Generally, you're going to see some improvement in your skin pretty early on. However, to see the full results, you're going to have to wait until the skin has fully healed. So that can take anywhere from 3 to even 6 months after your treatment. When should you call your surgeon? You should call your surgeon if you notice any signs of infection, including pus, increased swelling, pain, or if you notice that the redness or the heat around the incision sites is getting worse, not better. Also, if you notice any new or worsening dark spots that do not seem to be fading over time, make sure you contact your surgeon. In summary, the skin falling off after CO2 laser treatment is a normal part of the healing process. It typically starts around 2 weeks after treatment and can last for several weeks to even months. To help speed up the healing process, avoid sun exposure, keep the area clean and moisturized, and don't pick or scrub the skin. Contact your surgeon if you have any concerns or notice any signs of infection. Remember that healing takes time and patience, but the results are worth it. All right, thank you so much for watching. If you enjoyed this video, make sure you subscribe to my channel and leave me a comment below. Let me know what questions you have, and I'll be sure to answer them. Thanks again for watching, and I'll see you in the next video.